Hello, everyone. This is David Harlow, also known as Health Blog, coming to you live from Boston today. And I have with me Dr. John Noseworthy, President and CEO of the Mayo Clinic. Dr. Noseworthy is a neurologist at Mayo and has served in his current role as President and CEO since 2009. Also with us today is Lee Acey, who's the Director of the Mayo Clinic Social Media Network, and he is manning the blab control panel here. Thank you all for joining us today. We're going to be getting into our conversation here, and I welcome and invite all viewers and listeners to send us your questions. You can drop them in the sidebar, and Lee will be moderating the Q&A as we go. But to start off, Dr. Noseworthy, I want to congratulate you on the Mayo Clinic's recent recognition as top hospital in the U.S. News and World Report annual rankings. Mayo, of course, was also recently recognized with the CMS 5-star ranking and high marks from the Leapfrog group as well. So I have to ask, what do you make of all this? And do you actively court these sorts of rankings? There are some things that I know are just based on clinical experience, quality measures. There are also some things that are based on patient questionnaires, patient reviews, patient satisfaction, which sort of demands a different sort of attention. So I ask you generally, what is it about these rankings that we should be interested in? How may they be different one from the other? And, do they capture the whole story? Locally around my neck of the woods, there's some people are crying foul over the CMS 5-star rankings, things like that, academic medical centers that end up with 1 star and say, well, the usual response is, well, our patients are sicker and more complicated, et cetera, et cetera. So to back up, I want to hear about your experience, how this quality recognition relates to what you're doing generally, and how you see it as being meaningful.
Well, Dave, I really appreciate the opportunity to talk about it. Thank you, and thank you for your kind words. So just a bit of background. Mayo Clinic is an integrated not-for-profit healthcare organization with research and educational activities. It's an academic medical center. But we are led by salaried physicians and team-based care that's been evolving for decade after decade after decade to meet the needs of our patients. And because we've been founded in excellence and teams forever, the patient experience has been front and center for us for a very long period of time. We've been urging the government and payers and the rating agencies to make these ratings more data-driven, so patients can actually look and see, how is my outcome going to be different at Hospital X or Hospital Y? So these increasingly data-driven rankings, I think, are important for the transparency that's needed in healthcare. They're all a little different, as you've suggested. U.S. News is the one that is generally considered the marquee that most folks look to. The CMS 5-star rating that you referred to is relatively new and evolving and contentious in some circles, and yet it's basically signaling what CMS thinks is important, and so it's getting folks' attention. In terms of Mayo's positioning on this, we certainly appreciate very much the work that our staff do, and it's our staff work that achieves the outcomes and the ratings for our patients. So we're pleased that in virtually all of these, and there are about a dozen of them that are often quoted, and Mayo's usually are almost always in the top decile in those. So they're measuring something that's common, which is better outcomes and a patient experience. And so we're pleased with that. Do we position ourselves for one ranking over the other? I would say we don't. I think our goal is to provide better outcomes at an affordable cost, bring cutting-edge care to our patients, get the diagnosis right, and so on. And we do pay attention to the patient experience, and some of these are more experientially weighted, as you suggested. U.S. News is not particularly related to the patient experience, the amenities, and so on, but others are. So just on the U.S. News, just to quickly recap, the reason Mayo Clinic is the highest rated hospital this year is that there's been a change in how they weight the ratings. In the past, whether you were the number 1 in a specialty or the number 9, or the number 10, I should say, you were ranked the same. You got the same score. If you were number 11 or number 20, you got a slightly lesser score. And this year they said, well, actually, number 1 is better than number 2 is better than number 10, and number 11 is different from number 20. And since for a very long time, Mayo Clinic has had a number 1 ranking in at least 8 of the 12 index specialties, if you will, 8 gold medals, and 3 silver medals and a bronze. So we've medaled in all 12 index specialties. That distanced us quite a bit from the other outstanding hospitals in the country. Similarly, they're placing much more emphasis on the quality of care and the outcomes in those 9 complex conditions and procedures: aortic valve surgery, aortic aneurysm surgery, lung cancer surgery, heart failure, those kinds of things. And Mayo Clinic scored at the highest level in all 9 of those. And the combination of those and a de-emphasis in the so-called reputation, which is a subjective rating, worked to our advantage. If you go back over the last 5 to 10 years, and this arithmetic approach to the scoring, U.S. News, had it adopted that, we would have been number 1 for a very long period of time. So it's a shift in that. Right. It isn't a shift in what we do. We don't change what we do every day. We try to learn and earn the respect of our patients. And I was pleased, again, that our campus in Arizona is the top rank in Arizona, and has for 4 years, and our Florida campus tied for number 1 there. So it's really a national footprint on excellence based on outcomes for patients with both serious and complex diseases. That's really what this measures. The CMS 5-star ranking, as you saw, created a lot of heartburn around the country, in that only 2% of all the hospitals receive 5 stars, and only 2% of the academic teaching hospitals received 5 stars. Now, again, Mayo Clinic received 5 stars in all 3 campuses, including our large community practice in Eau Claire, Wisconsin. And there were no other top 20 honor roll U.S. News hospitals that received 5 stars. So there's something different between how U.S. News rated hospitals in America and how CMS did. I've seen the concern about the CMS rating doesn't adequately correct for complex care. And that's the general feeling of many of the teaching hospitals, as only 2% of them achieved it.
I was going to say, I'm sure you see plenty of complex cases.
We see more complex care than any other hospital in the country. Right. So it's something about the way it's delivered and measured that is different. I don't know the details of that. I think that you asked why it's important to us. I think it's an affirmation of the hard work that people do. And we're a professional service organization, and so our staff are pleased when their hard work is recognized. It's also a place where patients and their families go when they have serious or complex health problems. Jeepers, Uncle so-and-so, are you sure you're getting the right opinion? Can someone fix it or sort it out for you more quickly, and so on? And so they go to these rankings, and that's the transparency that I think all of us basically believe is important for patients to have that choice. And that's certainly the case in the international market. It's increasingly that way in the national market. And again, Mayo Clinic sees patients from almost 150 countries every year or so, and all 50 states. So it sort of plays into what we've been focused on, which is how do we find answers quickly for patients who have serious and complex
Right.
problems,
Right.
and give them
So
the
to me,
appropriate answers.
as
So
you've described,
that's the story.
you've highlighted what I've always understood as sort of the key focus of Mayo Clinic, or the grounding of the reputation of the Mayo Clinic, being grounded in sort of rare disease or undiagnosed conditions for patients who come to you from all over, or for second opinions. I mean, my understanding is that to a great extent this is still the case, though I understand that you've been devoting greater efforts to telehealth in recent days. Could you speak to the expanding telehealth efforts of the institution?
Sure. Absolutely. But if I could just make a fine point or a little bit of a correction, we see a larger number and treat a larger number of patients with serious and complex medical conditions than anyone else in the country. Some of those are rare, but the overwhelming majority of them are the serious complex problems that are common. So hip and knee replacement, spine surgery, heart surgery, cancer, we have the largest transplant program in the country, and so on. Now, that said, when you've seen, as in my personal situation, 5,000 cases of multiple sclerosis, when a person comes in who everyone thinks has MS, and you've seen enough MS to realize, wait a minute, this is a canary, this isn't MS, this is not a common condition, then I would have had in my career an experience with the very rare conditions that can mimic MS, whereas another person who's seen maybe 100 cases of MS wouldn't. But it isn't the rare cases so much that drives this. It's the performance on the serious conditions that are common to people in everyday America, if you will. In terms of the telehealth, I'm happy to speak a bit about that. We've gone through, as you know very, very well, merger mania in this country. All the hospitals are getting larger. They're acquiring community hospitals. They're building a network, and some of them are working with insurance companies to put that footprint across the country. We've taken a different approach to that, and we basically said, we're the Mayo Clinic. If we acquire a lot of other hospitals, they're not the Mayo Clinic. It's not the Mayo Clinic anymore. And we decided, David, that if we digitized our knowledge, we could share it using mobile technology or telehealth and so on. And so we basically went through a very aggressive and focused effort to digitize how Mayo Clinic thinks about complex diseases. So I'm seeing three of us on this call. You could be the heart surgeon, Lee could be the cardiologist, and I could be the anesthesiologist. And we could say, when we have a patient with this kind of heart surgery, cardiac condition, how would Mayo handle that? Digitize that, make that an answer. And then that becomes a product that's useful for physicians in a community practice or in a smaller academic practice that say, boy, I've never seen one of these before. What would Mayo Clinic do? We created that as a product. We call it Ask Mayo Expert. And we basically use that to build now a 40 hospital system network nationally and across the country, sharing what we know with those who subscribe to Mayo Clinic in what's called the Mayo Clinic Care Network. The beauty of that is it allows Mayo Clinic to share what we know broadly with now over 16 million patients and their providers at no cost, if you will, to the patients. So when they go in and the doctor says, let me ask what Mayo Clinic would do in your situation, there's no cost to the patient. The hospital system pays a subscription, but the patient doesn't. And 80% of those patients, or in some cases closer to 90, don't have to leave their home community and travel to the Mayo Clinic to get an answer. So it's been a low cost for patients, high value opportunity. And yet the complex ones, the ones that are like, we can't manage this in Pikeville or Santa Monica or wherever, Santa Barbara or wherever, you have to go to the Mayo Clinic. By the time the patient comes to Mayo Clinic, we know all about them and we can dig right in. We've also been rapid adopters and have built the telehealth networks for other things like stroke, as I know you're referring to. But we also just use simple technology to have community obstetricians and pediatricians have access to the delivery suite. So a routine baby's being delivered 100 miles away, and the baby all of a sudden is in distress, just using a mobile platform, I guess I could say an iPad, they can be visiting with an obstetrician or a neonatologist at Mayo who says, no, use a number 12 catheter here and suck them out, turn them, do this, and save a baby's life. So the opportunity for telehealth to extend Mayo's knowledge is something we're leveraging for the good of patients. It's not as much a business play as a sharing our knowledge. Mm-hmm. And now in
you've also been involved in other sort of,
I
guess I might say, earlier stage efforts in that realm in terms of trying to capture the knowledge, the information that maybe resides in your records, whether it's through genomics research generally or through work as part of the Optum Labs initiative. I wonder if you could speak to that as well. What, is that, does that yield current clinical results, or is that sort of longer term?
So Mayo Clinic decided that, or we looked at the value equation, outcomes over cost. And everyone's studying outcomes, safer care, that's a great thing. But it's been hard to get your arms around the cost of healthcare. That's been the real hard one to crack. And so basically, Mayo Clinic and United Health Group came together with us. Basically, I talked to Steve Hemsley and said, Steve, let's create an open innovation lab where providers, payers, device companies, academic medical centers, policymakers, whatever, could put their data into this open database in Cambridge, just probably within walking distance of where you're sitting, and create that open Bell-like innovation lab where we can look at outcomes and cost and then see what works in healthcare. We now have over 25 partners in that. That allows us to ask very interesting questions using big data tools very, very, very quickly. We can basically reproduce a 3-armed, 5-year randomized controlled clinical trial using these outcomes data from this data and see whether or not we can reproduce it in different populations. So we can get quick answers. Now, there are limitations when you have that sort of data. It's not everything is in the database, but it does provide some hypothesis testing that we can move forward pretty quickly. We're now working with CMS to get the CMS data in there so we understand not just the commercial lives, the under 65, but beyond that. So again, it's moving, and it's a very large database. It's by far the largest of these databases that we can use. That's worked extremely well. There's lots more to do there. But again, it's all in that spirit of how do we take the data, how do we take what we know and leapfrog forward and try to get answers more quickly to bend the cost curve and create a sustainable, high-quality healthcare system, especially in our case, for patients who have serious disease. This isn't so much about primary care and population health, although in that Optum database, there's a lot, obviously, about diabetes.
You've started to answer the question that I was going to pose next, which is sort of what I call the Spider-Man question. With great power comes great responsibility. And you're using the tools and the information that you have in order to move the ball forward, as you've described, not only in Rochester, but around the country and around the world. You mentioned diabetes or other chronic conditions as well. We collectively do not do a very good job in prevention and treatment. The burden of disease remains incredibly high. And I'm wondering if there are any particular efforts that you've identified or are looking towards along that realm, as you'd say, population health, that may not be the focus of the institution as a whole, but it is something that obviously needs attention. And it sounds like you have the informational and clinical resources at hand that could help address these issues.
Well, that's very perceptive, Dave. Thanks so much. So I think our willingness to share what we know is a step forward. That's part of the Spider-Man. We can help, and we're a humanitarian not-for-profit, so we've always shared what we know and put it out there so that others can benefit from that. And so that's part of that humanity, that sharing, if you will. The other is, though, of course, our investments at Mayo Clinic in genomic medicine or regenerative medicine play out for these common diseases. So by investing heavily in individualized, or as the president calls it, personalized medicine, and now receiving the award from the NIH for $150 million for the biobank for the country for the million lives for genomic medicine. Again, we're partnering with the country and with the government to make that happen so that that data can be probed by others. The regenerative medicine efforts that we've made at Mayo Clinic, the investments we've made there to understand how does the body heal itself? How can you take advantage of patients' regenerative properties and develop cell-based therapies and that kind of thing to help regenerate the body is going to be important for vascular disease, for diabetes, for hearing loss, for wound healing, maybe one day for neurological conditions. So again, Mayo has to be able to say, how can we contribute to this matrix of healthcare issues in the country?
Great.
And we're happy to do that.
I wanted to ask about sort of the planning efforts that you've undertaken over time and sort of where you are along that path. I believe you were involved in putting together a report a while back for Mayo called The Path to 2020. So how are we doing?
Well, 2020 is around the corner. I mean,
yes.
As perhaps you've experienced, time seems to go more quickly the wiser we get. So yes, in 2007 and 8, we mapped out where Mayo Clinic needed to be in the year 2020. And we're actually following that. That's been our strategic direction, and the operational plan to execute on that plan has gone quite well. The focus of that was 3 parts. How do you make certain that as a destination medical center where patients come from all over the world, we have all the resources and all the research and the right workforce to deliver that? That's part 1. Part 2 is how do you connect with the physicians and the patients who aren't at Mayo Clinic? And that's really what we talked about with the Care Network, if you will, and some of our digital platforms. And then the third part of that is really how do you do this in a fully digitized world? And how could we share what we know with 200 million people? That's been sort of our stretch goal, if you will. How do we have a meaningful relationship with people who've never been to Mayo Clinic? And that's moving ahead. I think that's around the corner. I don't think it's right in front of us. Based on our calculations, we're having a meaningful interaction with about 60 or 70 million people a year. But it's not quite the curated service that we will one day have, where consumers, patients should expect to have 24/7 access to whatever they need, whether it's healthcare or consumer needs. We're working on that. There's a lot of regulatory issues around that, as you very well know. The business models have been clunky because of that, but still creating the knowledge and the culture internally. And it's not so difficult to create that internally, because if you're part of Mayo Clinic, you basically have said, I want to be part of a community that's committed to the world in a good way. I want to do good work going forward. That means I want to work with others and share it with others. And now, increasingly, how does Mayo Clinic partner with the groups that can create that platform and that distribution arm of our knowledge and learn from others? So that's moving ahead. So we're midway through refreshing that path to 2020. It's probably 2030 now, 2025. But again, it's when one's going through the upheaval in healthcare that we're going through, you still have to do the work to make sure you're providing good care and having a successful business performance, so you can invest in these other platforms or other strategies.
Thank you.
I'd say we're
as we wrap
doing
up,
rather
Dr.
well
Noseworthy, I'd like to ask, as you think about sort of what's next for Mayo Clinic, how do you, in your role, reconcile the spirits, if you will, of Dr. Will and Dr. Charlie looking over your shoulder with the current challenges you face and some of these ambitious plans for the future that you've outlined?
Well, they were marvelous visionaries, surgeons, leaders, and we touch with them every day. What did they say? We try to anticipate. What are we staying true to that? They basically said the needs of the patient come first, and they moved heaven and earth to make sure patients receive that care. So I think they'd be pleased with a lot of the investments that we're making. They were also extraordinarily generous in terms of how they dealt with humanity, their civic responsibilities, their responsibilities with the military. World War II, basically, they and their scientists helped create the suit that kept pilots from blacking out, the G suit, I guess it was called. We got paid $1 for that, but it helped shorten the war. I mean, it was a big deal. So we hope that our global and humanitarian efforts are in alignment with what they would want. They also frequently refer to something that's called the spirit of the clinic. The spirit of the clinic is that intangible culture of caring and sharing going forward, that generosity. And they said that's why Mayo's successful. I think that's why we're successful today. So I don't know. Someone told me early in my tenure in this job, said, you're going to have to answer to Dr. Will and Dr. Charlie one day. So, and I kind of put chills down my spine, but because they were great people. Internally at Mayo, it's not about the CEO. It's not about me or even about my leadership team. But I can tell you, David, if we stray ever so slightly away from the core values of Mayo Clinic, I've got 60,000 vice presidents out there who will say, "Hold on, you're going away from what drives us, which is our humanitarian and core values, which are very important." So, steering the good ship Mayo through this time is exciting. I feel we're shaping the future, not for Mayo, but for healthcare in general.
Well, thank you very much.
I'm very proud of our staff.
Thank you for taking the time to speak with us today, Dr. Noseworthy. I very much appreciate it. We've been speaking with Dr. John Noseworthy, President and CEO of the Mayo Clinic. And this is David Harlow at Health Blog. Thank you for joining us, and hope to see you again soon.
All right, thanks.
Thanks very much, Dave.